Live. I'm live. It's Tuesday night Q&A. A bit of a slightly different format tonight because I've got so many questions about one case that I'm going to do it all on the case, which is a large lipoma. And I got a photo of the lipoma, which I thought I could show on Instagram a photo. I know I tried this last time. If anyone knows how to show a photo on Instagram. Comment. Similarly on TikTok, I don't know how to show the photo. Anyway, yeah, okay. So we'll just have to. I can maybe show the. Yeah, I've definitely done it before. I don't know how to do it. Anyway, we'll gloss over that because I can show it on YouTube and Facebook. So yeah, okay. So I'm going to try and show it. Got quite a lot of things going on here. Right, okay, let's show it. Can you see it? There it is. See it? Yep. There it is. And right, let's show it on the back. You see it? You see it? Anyway, it's big lipoma on the back. Big lipoma on the back. So I've got loads of questions about it. So I'm going to go over these questions. And if the person who's lipoma, because I think they were asking today, if it's their lipoma and they want to talk to me about it, they can talk to me about it. They can come back at me. So yeah, and if you've got any other questions about anything else, then you can feel free to fire away, and I'll be very happy to answer them. Hey JJ, hey my girl Josephine, nice to see you. You're my girl. How are you? So, what have we got? We've been told that a local anaesthetic is used, which suggests injections around the site. Other than those, you have to put a cannula in place just in case. Okay, so I'm going to talk in general terms about doing things under local anaesthetic. So there's a question. Basically, there's a overarching question as to whether we can do this under local anaesthetic or not. It's Jody lol. Jody, see, this is what happens to me. People, Instagram's gone dead. People, I mean, Jody, why are you calling yourself Josephine? And hi, Jody, how are you? We can see the photo. I know, yeah, YouTube and Facebook can see the photo, but I think that. Well, I know that Instagram and TikTok can't. So anyway, right, sorting things out live here. Rotate the screen. So anyway, yeah, I think the whole thing is a requisite on whether we can do this under a local anaesthetic or not. And I'm going to come to a conclusion at the end about whether we can do it under local or not. Well, I'll tell you now. I don't think this will be suitable for local. I think just looking at the photo itself, I would say it's on the cusp of what you can do under local anaesthetic. And it kind of depends. Rotate your camera 90 degrees. Oh, I see. It's telling me to rotate my camera. Sorry, I'm just doing TikTok. What's this? Jody. Oh, you're doing. Oh, that's just my answer. Oh, hi, Jody. How are you? Yes, I know you, Jody. Yes, of course I know you. So my girl Josephine is Jody. Right, Jodie, good to see you. And Jodie, if you've got any questions, hit me with your questions, because I know you like your questions. So, physically rotate your external camera 90 degrees counterclockwise for the best image quality. Well, that's still sideways, isn't it? Hi, Jodie. Yeah. So I think this is on the borderline. I don't think this is going to work very well, actually. On the borderline of what you can do under local, and I think it will depend on the patient. But let's just say we were doing it under local anaesthetic. I'm going to put that away because that's distracting me. And I've got to focus up. Then yeah. Oh god. Sorry, it happens every time I turn. So if you're having something done under local anaesthetic, no, you don't have a cannula. You don't have a cannula in place. You're completely awake, completely conscious. You don't need a drip, so you don't have a drip in your arm, just in case. It's just purely anaesthetic in the site, and there is no drip. So yeah, that's the first one. You've actually answered all my questions, Jodie. Well, I'm sure you'll think of some more, and if you do think of some more, please hit me up. Is that an okay thing to say? Yeah. So yeah, there's no cannula if you're having something done with local anaesthetic. It's just injections around the site. How long is the incision likely to be? How will this affect moving, twisting, bending, etc. during the healing process? So the incision is likely to be, for lipoma removal, is about the size of the lipoma. So if you have a big lipoma, you have a big incision. So it's about the width of the lipoma. Always try and make it a little bit smaller than the lipoma because there's usually a bit of compressibility with it. But obviously, the larger the excision, or incision rather, the easier it is to remove. But you obviously want the smallest scar as possible. So there's a balance there. So I try and make it a bit smaller than the width of the lipoma, but I would kind of plan to have it about the width of the lipoma. So if you're not happy with that, it being that long, then don't do it. But as I say, whilst I would say it's going to be about the length of the lipoma, it might be a bit smaller. And how will it affect the twisting, bending, etc. during the healing process? It'll be absolutely fine. The thing about lipomas, because they're underneath the skin, you don't actually remove any skin when you take a lipoma out. So you will often the camera a bit of a clean. So you're not actually taking any skin out. So it's not closed under tension. So it's not too sore or not too tight. It will be a bit uncomfortable, obviously, because it's quite a big one. And your body will tell you that it will be uncomfortable. So you will be a bit uncomfortable bending, twisting, etc. during the healing process, but you will still be able to bend and twist and do all the things you can normally do, but it's just be a bit uncomfortable because you have a long scar on your flank. So it's on the flank, by the way, viewers who haven't seen this. It's a large lipoma on the flank. You'll have a look at it on YouTube or Facebook if you're interested, because it's on the screen there. How many stitches would you estimate would be needed? How long do they stay in, and how are they removed? So the stitches for this sort of thing will be dissolvable. So there will be multiple stitches deep underneath the skin, taking the tension off the wound. 10, 15, I don't know how many stitches. You won't see them though. And then there'll be a running stitch in the skin, which again you won't see. So you won't see any of the stitches. So it kind of doesn't matter how many stitches really, because you don't see anything. You just see a healed wound. The stitches are all underneath the skin. And so they take a couple of months to dissolve, but again, you won't see them. The only thing you might notice is that it might go a bit red. So it often goes a bit red in the first few months while the stitches are dissolving, and then it's okay. But in terms of having stitches removed or anything, you don't need to have any stitches removed. They will just dissolve, and you don't see them, so you don't have to worry about stitches. As the lipoma is quite high, what happens to the stretched skin after the procedure? Good question. So this is a big lipoma and it's tenting the skin up. In my experience, usually the skin will recoil and settle, but when you first have it done, there will be a dent and there will be redundant skin because the lipoma has stretched the skin, as you say, and there'll be a kind of dent where it was because it's quite a big one. Now that dent will fill, and sometimes it fills too much, it swells up and you get a bump. And the bump can look like the lipoma. So the lipoma, it looks like the lipoma is coming back again in the first few weeks, but you have to give it a few months for the swelling to settle, and then it all settles down and the skin recoils. So I would imagine the skin would recoil and would sort of redrape, and it'll be fine. So the other thing is, you might say, well, why don't you take some skin out, because there is excess skin there, which you could do. Could take some skin out. That would involve taking a ellipse of skin out. Risk of causing a dog ear, which is little bumps at the end of the scar, which you can get when you take an ellipse of skin out. So I would tend not to take an ellipse of skin out. I would tend to just make an incision and accept that there will be excess skin there, and then in time that would recoil. Georgina, don't be sorry, off topic. I love different topics. I've got a couple of questions on the lipoma, then I'll do your question, Georgina. Not off topic at all. I normally do loads of topics, but I'm just doing lipoma removal today. I don't know what that noise is, but yeah, so the skin might be a bit stretched and might have a dent, and there might be all sorts after removing a big lipoma and that, but it should settle down. If it doesn't settle down, you can take some skin out and things later on, but it usually does, and you're better off limiting the scarring, limiting the risk of dog ears and bumps and stuff by just making an incision. How long is the procedure likely to take? What is a series of events? So taking a big lipoma out there, maybe a couple of hours. If it was if it was done under local, then you would come in, you would have a chat with us, we go through everything, and we take you up to the so we do a see and treat. So you just come in and see us, and we do it there and then, and we'd have a chat with you, go through your history, and if everything's fine, then we'd do the surgery, and then you come and sit and have a cup of tea in the waiting room, and then you would go home. If it's a general, it's a little bit more of a palaver because it has to be done in the hospital, which is up in Liverpool at the moment, and you have to come in a bit beforehand, be admitted to the hospital, and you have to stay a few hours afterwards. So if it's a general anaesthetic, you will be in all day, pretty much. But if it's a local, you'll be in for a few hours. When would you want to know the medical history, current medication? So basically, as soon as possible, you want to know the medical history. Now, we do offer a see and treat service where we see people. We often the first time you're seeing people is when they come to the clinic. So if you have got a significant medical history, as this patient does have, then it is good to know that prior to seeing them. But if we don't know it, then we'll take the medical history usually when we see you. But if you have got any medical problems, it's always good to let us know beforehand, because we may not be able to do it either on the day or either at all if there is some medical history that we didn't know about. So tell us as soon as possible, but if you don't tell us, then we'll ask you when you come in. We'll go through a full history and examination when you come in. What type of anaesthetic is used? So if it's a local anaesthetic, and it's the one we use is lidocaine with adrenaline usually. How long will the area remain numb? Several hours, 4 to 6 hours. Take a while for it to come back to life. It doesn't really matter in that area. It's more of a problem in the lips and things, because you can burn your lips if you have a cup of tea. So you've got to be a bit careful if you're having it around your face, because your lip can be numb. But for this area, it probably won't matter too much. But pretty much the rest of the day, the area will be numb. Can we apply Emla cream prior to the injection? Yes, you can. If there is a fear of needles, yes, you can. I don't normally advise it. This is quite a big area, need quite a lot of EMLA. For me, I think it just adds to the anxiety, the whole thing. It does help with the needle, the EMLA, but it doesn't help with the local stings going in, and there'd be quite a lot of injections, quite a lot of stinging. So it would be, so there's several reasons why I think this one's not suitable for local anaesthetic. One is the size. As I say, it's borderline because of the size. It's very large, and we have a maximum dosage of local anaesthetic we can use. So I think this will be on the edge. The fact this patient is saying they've got a fear of needles and they're talking about EMLA cream, then I think, well, I think you should have a general anaesthetic, because I think there'll be a lot of needles, and if you're anxious about it, it makes it a very potentially unpleasant experience, because there's lots of injections, and it may be that you will feel stuff because it's such a big lipoma. So really, if you're going to do a big one like this under local, you really need the patient on side who really wants a local and is really up for it, and is really sort of okay with the fact they might feel bits, to be quite honest with you, because we have got a limit on how much local we can use. So it'd probably be better to do that under a general. Can we increase the bisoprolol a day or two before the procedure to reduce anxiety about it? Again, the answer to that is no. I wouldn't mess with the bisoprolol dose. It's a beta blocker and it does help with anxiety, but I wouldn't change that dose. And again, that's another reason not to have it under local. If you're anxious, if you've got anxiety and things, then I think a local will be very difficult for you for such a large lesion. And so I wouldn't increase the dose, and I wouldn't recommend having it under local if you have got anxiety about the procedure. What post-procedure painkillers are prescribed, stroke given, how are more obtained if needed? The normal ibuprofen and paracetamol, so non-prescribed medication, just normal medication you got at home. People often think, oh, hold on a minute, they're painkillers for headaches and things, but they're actually very good painkillers, and it will probably be a bit sore, but it won't. Hopefully, pain won't be much of an issue. If you have it done at the hospital as a general anaesthetic, then they can give you things like codeine, which are stronger painkillers, but you've got to be careful with those because they can constipate you, they can make you feel sick and do laddy and things. So I normally don't recommend codeine unless you've got a lot of pain, and hopefully it wouldn't be that painful, really. Hopefully it'd just be a bit sore, a bit uncomfortable. How is the post-procedure follow-up examination carried out? Well, normally a week, so stitches all dissolvable, waterproof dressing. I think there was a thing about dressings in showers and stuff. So you can shower straight away with the dressing on. So you shower day one. The dressing's waterproof, just go a bit easy on it, don't go crazy on it. We see you a week for dressing. If you want to, you can do it yourself, because it'll be just basically taking the plaster off. So you can do it yourself, or you can come in and see Rose. If you do it yourself, Rose will give you a ring, see how you're getting on. You can always send us a photo and what have you. I then catch up with you at 6 weeks. Scar will be red then. Got you massaging the scar and what have you. And then normally 4 months after that, which is 6 months post-op. Then a year, then, well, it depends on what you need, really. Usually things are pretty well settled at 6 months. But if they're not, I can see you 6 months later, a year post-op. But see you as often as you need. But the general regime is a week for Rose, 6 weeks for me, then as needed. So if you're fine at 6 weeks, then that's it. If it's a bit red and a bit lumpy and a bit bumpy and a bit of a dent or a bit of a bump or whatever, then I might say, look, let's catch up in another 4 months to see how you're getting on. And usually it's settled by then. And if it's not, we can do what needs to be done to fix it, to unsettle it. Whew. So yeah, I think that's all the questions. If you're out there, whoever's this is, if you have any questions specifically that I haven't covered, then please do ask away. But that was the lipoma photo questions. So I've got some questions here. So hairdressing BYTX and Georgina. So Georgina, what you got? So Georgina on Facebook, my tattoo is depressing me. Could I have it surgically removed with a local anaesthetic? I have E-type asthma. Will this prevent treatment? I would sell my soul to get rid of this tattoo on my chest, but cannot have a general. Well, the answer to that, Georgina, is send us a photo. On your chest isn't great for scarring. I've got to be honest with you. Chest is not a great area for scarring. It can leave nasty scars. But if you send us a photo, you can either, can you send a photo on Facebook? I don't know. If you can't, you can WhatsApp it to us. The WhatsApp number should be sort of in place. I think it's on Facebook. There's a WhatsApp button, is there? A lot of people WhatsApp photos. Send us a photo, we'll have a look. And but the chest is not great. The other thing is the dimensions, the shortest dimensions. So if it's kind of like long and thin, it might be suitable. But if it's short and fat, it might not be suitable. So we want to have enough skin to stitch up. And it depends on where on your chest. Over your sternum, over your breastbone, over your breast, sort of upper chest. It's not a great place. 2 inches square. 2 inches square. I'm going to have a look at it, see if there's enough laxity to close in one go. If not, I might have to have a couple of goes at it. But as I say, it is something cosmetically speaking that you might be worse off having it excised, because the scarring can go lumpy on the chest. So it depends, as I say, it depends on where on the chest. If it's sort of like around the side, the lateral chest wall or something, maybe. But if it's kind of like in a kind of cosmetically sensitive area, which it may well be because you want it removed, so it might be in a sort of obvious area, so that might make you conscious of the scar instead of the tattoo. It's always a problem with removing tattoos by excision, because you trade it in for a scar, and you don't want to make the scar worse than the tattoo. So you have to be a bit careful on that. Right, what's this? Josh, good one, Josh. So we've got Josh, and we've got hairdressing. So yeah, we've got some other questions, so I will answer those. So I would rather a scar. You will understand when you see it. Okay, well, send us a photo, Georgina, and very happy to do a scar if you're happy to have a scar. But I would warn you that sometimes people think plastic surgeons don't leave scars because they're brilliant, which is obviously true to some degree, but we do a lot of stuff on the face, and the face scars well, and other parts of the body don't scar as well, and the chest is not a fantastic place for scars. But if you prefer a scar, then it's a we have done tattoo removal on the chest, so it's something that we have done before. So and 2x2 potentially could be a goer. Well, it might need a couple of goes if it's a bit tight. But send us a photo, and we'll give you an idea whether we can do it, what would it cost, what would be the plan. Come in and happy to help if I can. So yeah. So yeah, hairdressing, and then Josh. So hairdressing. I'm having a mole remove with you on 20th of Feb. Am I able to drive home after it? Hi, is the scarring bad on the face? Yeah, no hairdressing. The scarring, fortunately, is good on the face. You'll be pleased to hear. If you ask me specifically, can you drive afterwards? When you look at the little piece of paper you get with the local anaesthetic, like if you get paracetamol, if you read that piece of paper, the sort of risks of paracetamol is huge. So on the local anaesthetic, it does say you shouldn't drive for 12 hours, I think, afterwards or something. But to be honest with you, everyone does. I mean, the dentist doesn't tell you that you can't drive home, can you? People drive to the dentist all the time and have a local anaesthetic. So the bottom line is, yeah, you can drive home afterwards. But you might want to have a cup of tea, make sure you're comfortable. It's nice if you can have someone to drive you. But if you can't have anyone to drive you, people do drive home afterwards. But as I say, on the sheet of local anaesthetic, it says don't drive, but everyone does. And the scarring just tends to be better on the face. Kind of depends a little bit how old you are. It will be better if you're older, if you've got some lines and wrinkles who can hide the scar, or the position of your mole. If it's kind of in a crease like here, natural lines on the forehead, or hidden like in front of the ear or something, it's better than if it's kind of in a place where there's no creases or wrinkles or lines. So the location does matter, but generally speaking, the face does tend to scar well. And a bit like the tattoo, you'd be trading your mole for a scar, and question is whether the scar will be better. But we go through that with you in the clinic hairdressing, and we go over it, and you can make a decision, so you don't have to go ahead with it. If you've got any second thoughts, you can have a think about it, show some photos and stuff. So perfect. I can't wait. I'm 25 and just above my lip. Yeah, they do quite well just above the lip. Tend to do them in that sort of direction. Depends how close to the vermilion it is. Pink, we've got to be a bit careful that we don't breach the vermilion, the pink of the lip. But yeah, tend to do quite well above the lip. But yeah, we're happy to see you. I booked for the see and treat. Yeah, so even though you book for the see and treat hairdressing, you don't have to have it done. We'll be ready to do it on the day. We'll be all set for it. But if you're not sure, you can always sort of postpone it or whatever. So there's always a option to think about it if you want to. But yeah, if you do want to go ahead, we'll be ready to do it on the same day. So Josh, what you got? Best scarring cream for a small central forehead epidermoid cyst removal, 2 months post-op, thanks. So Josh, first of all, if it's me, great, that did your surgery. If it's not, take anything I say with a pinch of salt, because I don't want to get in trouble with your surgeon. So for me, I normally wait until 6 weeks 2 months post-op. Okay, that's good. So if it's healed nicely and probably a bit red and a bit lumpy and a bit firm, the main things are moisturize and massage. So the moisturize is the cream. Personally, I don't have a strong view about cream. I don't think there's any evidence to say one cream is better than another. We have one at the clinic called QV cream, which we sell, but I don't think it's just nice. We all like it, and that's why we sell it. But I don't think it's kind of medically better. I think any sort of moisturizer, Nivea, E45, aloe vera, coconut butter, anything you want, sort of any sort of cream, any moisturizer. So it's the moisturizer, but it's also the pressure. So again, it's got to be pretty well healed. So if it's a bit sore, not quite healed, don't just go easy on it. But if it is healed and it is pretty firm, then just give it a bit of pressure, make it blanch, make it go white, just to try and break down that scar tissue. Circular movements 2 or 3 times a day. You don't have to go crazy on it. Circular motion to try and break down that scar tissue, because it probably feels a bit firm, to make it soften and the redness settle. If it's not hard and if it's not red, you don't have to do it. You just leave it alone. And the other thing to be aware of is being careful in the sun for the first 3 to 6 months after having a something like that removed. 100% go ahead. Okay, excellent. So yeah, that's the scarring cream. I would as I say, there's no kind of particular scarring cream. Also, hold on, Josh has come back at me. Hi Josh, what you got? Also, I noticed a tiny hole in the scar. I think the dissolvable stitch was, will it heal? Yeah, it's red and lumpy. Yeah. So yes, Josh, they sometimes do. The stitches sometimes kind of spit out. Oh yeah, okay. So if you've got dissolvable stitches, Josh, you're not my patient then, because I don't use dissolvable stitches on the face because of this, because they can get rejected and they can spit out things. So and again, if it's not kind of completely healed, if there's a little red spot and stuff, you might want to go easy with this pressure thing that I'm talking about. You don't want to like press really hard and massage really hard if it's not nicely healed. So always best to sort of stay close with your surgeon on this sort of regime. I think surgeons do have a bit of a view about post-operative regimes, and they don't always align 100%. So don't want to be telling you something that your surgeon would be against, but that's what I do. But as I say, I don't use dissolvable sutures in the face. So if you have got a bit of a reaction to dissolvable suture and it's a bit red and a bit like spitty outy, you might want to think go easy on it. But yeah, in general terms, so maybe go gentle on it and then build up over time. So I keep on doing that, and I keep on seeing the fire notice on my chair, which looks a bit naff. But are you supposed to leave them on, or are you supposed to take them off? I'm aware it looks naff. It's only on TikTok you can see it. But so if anyone's got a view about the fire notice, would you take that off? I mean, whenever you try and give the furniture to charity, they always want to see that fire thing, don't they? Or they won't take it. But so I've left it on this but it looks a bit naff when I'm doing my social media influencer work. So I don't know if anyone's got a view on that, but never mind. So yeah, thank you for that. Thank you for those questions. Thank you, Georgina. Look forward to seeing a photo of your tattoo. Give you an option. Give you an opinion. Hairdressing X BYTX. I will look forward to seeing you on the 19th, if it is me or we. I'll say we. Sorry, the 20th. We will look forward to seeing you on the 20th. Hairdressing. And Josh, good luck with the massaging of your scar. And if it all goes wrong, then I'll deny everything. Yeah. yeah, so always best to talk to your surgeon about these things. But yeah, that's my view on it, on scar management. Are vertical stretch mark-like patterns normal for a horizontal closure? Thoughts on Vaseline 2? Thank you. Okay, so vertical stretch-like patterns for a horizontal closure, Josh, sounds like you're talking about stitch marks. So you've got horizontal closure and you've got dots. Is that stitch marks? So presumably you had stitching the skin. How long were they left in? Normally leave them in 7 days. 5 to 7 days is normal. You shouldn't really get stitch marks for 5 to 7 days, but I don't know if yours were left in for longer than that. But there are lines kind of. I wouldn't say that's normal, no, unless it was really tight. Was it really tight? Was it a big thing? Do you say it was a cyst? Normally cysts, you don't actually remove skin, a bit like lipomas. You remove a little bit of skin because of the punctum. They often have a little sort of dot connecting to the skin, but they don't have much of a skin removal, so it shouldn't have been closed that tight. So no, I don't know without seeing it, Josh. But Vaseline. So we give patients Vaseline. We give all our patients Vaseline to put on it 2 or 3 times a day. But that's just in the first week or so, because it often bleeds a bit. And if it bleeds a bit and you come to have the stitches removed and it's all crusty, it's not very nice. So the Vaseline is just for the first week or so. When the stitches come out, sometimes it also bleeds a bit. So we normally give them the Vaseline just for like 10 days or so. But you're 2 months post-op. So in terms of moisturizing and massage, I don't think Vaseline is very good. It's kind of greasy and oily and it's not really a moisturizing cream. So I wouldn't recommend Vaseline now. Personally, I would recommend a moisturizer like, as I say, QV cream is what we use, or Nivea, E45, aloe vera, you name it. Any sort of moisturizer would do, but I wouldn't particularly recommend Vaseline now. Vaseline for me is in the early stages. There are lines kind of. No, I can't say that I've seen kind of vertical lines for a horizontal closure for something on the forehead. Yeah, trying to think what they could be. Aside from stitch marks. Stitch marks is the obvious, but if that's not what they are, then I don't know. Don't know what they are, Josh. Sorry. Maybe send a photo to your surgeon, because they know what they did. They know what they did. So they might be in a better position to help you out on that. So, yep, that's it. I'm out. I'm going to declare myself out. So, unless anyone's got a question, obviously, if you've got a question, just speak freely. But in the absence of Georgina, thank you. Penny Lowe, thank you for commenting. Hairdressing, nice to see you. Look forward to seeing you soon. And obviously, Josh, good luck with the horizontal lines and the scar. 2 months in is early days, Josh. Takes ages, takes 6, 12, maybe even more for the scar to settle. So I won't worry too much about stuff at this stage. It does take ages for scars to settle. So 2 months is, I normally say it starts to settle about 3 months. So you're not even there yet, Josh. So, stay strong. Should continue to settle. Cheers. Cheers, pal. Right. Increase the peace. I will see you next week.